Have you ever felt that sudden fear while going down the stairs, as if your legs might give out at any moment? Or that hesitation before getting up from your armchair, wondering if you'll have enough strength to stand without pain? If your answer was yes, know that you're not alone. After the age of 60, the body goes through natural changes. Muscle mass decreases, reflexes become slower, and balance requires more attention. According to the World Health Organization, 1 in 3 older adults experiences at least one fall per year. And with each decade after 60, we lose an average of 8% of our muscle mass. But here's the good news. This is not an inevitable sentence. There are clear, simple, and safe strategies to reverse part of this process. And we're not talking about expensive medications or impossible workouts. We're talking about smart exercises that you can do at home without fancy equipment, using only your own body weight and occasionally a sturdy chair for support. What makes these exercises so powerful is that they're not just repeated movements. There's logic, science behind them. Each one was designed to activate muscles that aging tends to leave dormant. Muscles that, when strengthened, restore the body's ability to move with stability, balance, and confidence. And I want you to see this practice not just as a workout, but as a test of autonomy. Let me show you an example. Did you know that something as simple as standing up from a chair can reveal a lot about your health? Rehabilitation researchers call this movement the chair stand test. It indicates the strength of the glutes, quadriceps, and core muscles, exactly the areas most affected by sarcopenia, the age-related loss of muscle mass. When you can get up from the chair without using your hands, it's like proving to yourself, I still have strength, I still have control. And believe me, this has not only a physical impact, but also an emotional one. Let's practice this first exercise together. Choose a sturdy chair, preferably without wheels. Sit on the edge, with your feet flat on the floor and shoulder width apart. Cross your arms over your chest. Now take a deep breath, gently engage your abdomen, and slowly stand up using only the strength of your legs. Then sit back down in a controlled manner, without letting your body drop. Repeat 8 to 12 times. Do 3 sets, 3 times a week. You might find it challenging at first, and that's normal. Maybe you can only manage 3 repetitions before feeling tired. But don't get discouraged. This is your starting point. I know a lady who, in the beginning, could barely repeat the movement 3 times without losing her breath. But in just 10 days, she was already completing 15 repetitions with a smile on her face. More than that, for the first time in years, she was able to get up from her armchair without having to mentally prepare for the pain. This kind of progress doesn't depend on luck. It's the result of consistency. It's you, day after day, giving your body the chance to regain strength and vitality. And this is just the first step. Now that we understand the importance of training functional movements, we need to talk about a muscle group that hardly anyone values, but is essential for your stability: the glutes. We often think of them only in terms of aesthetics, but the truth is, they are the most important muscles for keeping the body balanced while standing. When you climb a step, turn your body, or even walk, it's the glutes that stabilize your pelvis and prevent your torso from swaying dangerously. Lie on your back on a mat or even on your bed. Bend your knees, keeping your feet flat on the floor, hip-width apart. Place your arms at your sides for added stability. Now lift your hips until you form a straight line from your shoulders to your knees. Hold the position for 3 seconds, squeezing your glutes tightly, then lower slowly. Repeat 12 to 15 times. Do 3 sets. This exercise may seem simple, but science explains its value. When you contract your glutes, you're reinforcing the base of your pelvis, reducing strain on your lower back, and training your body to maintain proper posture during daily activities. People who practice this movement regularly report reduced back pain, more confidence when walking, and even better stability when climbing stairs. Now, I want you to realize something important. These first 2 exercises, standing up from a chair and glute bridges, already activate the body's largest muscle chains. They are the foundation of your autonomy. And if you start your routine with just these 2, practicing on alternate days, you'll already be on the right path to regaining strength and confidence. And by the way, tell me in the comments, Have you ever tried a quick technique to relieve lower back pain in your daily life? Did you feel a difference when applying pressure to the right spot or activating your glutes with the bridge exercise? Your feedback is essential for us to fine-tune every detail and grow together. I read all the comments and use your answers to plan future videos, always bringing content that can truly improve your quality of life. So comment down below. Which exercise gave you the most immediate relief? Thumb pressure on the painful spot, the glute bridge, or leaning on the wall to stabilize your hips? Also, tell me when your lower back pain bothers you the most. When walking, sitting for too long, or when getting up? Let's build this journey of smart and safe strength and relief together, one step at a time. Are you already part of our community? If not, subscribe to the channel now and turn on notifications so you don't miss any transformative content like this. And tell me in the comments, what's the biggest challenge you face today? Is it that persistent lower back pain that won't go away? Difficulty maintaining posture for long periods? Or maybe the fear of moving because you're afraid the pain will come back? Share your experience, because your stories inspire the next videos and help the entire community grow together. And don't go just yet, because next I'm going to show you a second movement that goes far beyond immediate relief. It's a technique that deeply activates the hip stabilizer muscles, corrects imbalances, and according to recent studies, reduces recurrences of lower back pain by up to 40% in active individuals. Stay with me until the end, because this might be the missing piece you needed to finally regain control of your body. Exercise 3, modified side plank. Lie on your side on a mat or carpet. Rest your forearm on the floor, keeping it aligned with your shoulder. Bend your knees at a 90-degree angle with your legs stacked. Now slowly lift your hips until your body forms a straight line from your knees to your head. Hold the position for 15 to 30 seconds. Then slowly lower down. Repeat on the other side. Do 2 sets on each side. It may seem simple, but this exercise deeply activates the lateral hip muscles and also the core, the central region of the body. It's like teaching your body to respond better in situations of imbalance. When you lift your hips in the side plank, you're activating the gluteus medius, a small but powerful muscle responsible for keeping the pelvis level. This same muscle is often neglected, even by people who exercise regularly. Weakness in the gluteus medius is linked to issues like lower back pain, misaligned knees, and of course, falls. Clinical studies show that strengthening this area significantly reduces the risk of household accidents in older adults. If it's hard to hold for 30 seconds at first, that's okay. Start with 10 seconds and gradually increase. The important thing is to keep your hips firm without letting them drop. Remember, the quality of the movement matters more than the duration. Exercise 4, side-lying leg raise. Now let's work the same muscle group in a dynamic way. Lie on your side, keeping your legs straight and aligned. Rest your head on your arm or on a pillow for more comfort. Raise your top leg about 12 inches, keeping your foot aligned and toes pointed forward. Hold for 2 seconds at the top, then slowly lower down. Do 15 repetitions on each side in 2 sets. If this movement is challenging at first, you can do it lying down on your bed. Over time, as you feel stronger, progress to the standing version, using the back of a chair for balance. In that case, lift your leg sideways while standing, hold for 2 seconds, and slowly return. This exercise activates the hip abductors, muscles that function like the tires of a car. Imagine your body as a vehicle. If the tires are worn out, steering becomes unstable and dangerous. Similarly, when the abductors are weak, your steps lose stability and the risk of tripping increases. Strengthening these muscles ensures each step is safe and confident. In addition, this movement also reduces pain in the hips and knees, improves posture, and strengthens the muscles that support the pelvis. It's especially helpful for women over 60 who face a higher risk of osteoporosis and joint instability. Here's the magic. When you combine the glute bridge, which strengthens the back, with the modified side plank and the side-lying leg raise, which strengthen the sides, you build a reinforced pelvic belt. This region functions like the foundation of a house. If the foundation is solid, everything else stays stable. If it's weak, any imbalance can cause cracks. And that's not all. Lateral stability also improves posture and reduces chronic pain. People who train these muscles report less lower back pain because the glutes begin to support the pelvis more effectively, relieving pressure on the spine. Each repetition you do is a vote of confidence in your own body. It's like saying, "I won't let age limit me. Now let's go even further." You've already strengthened the front, back, and sides of your body. Now it's time to work on integrating those muscles with exercises that improve coordination, relieve lower back pain, and give total stability to your stride. One of the most common problems reported after age 60 is lower back pain. It happens because over time, the glutes and hip stabilizer muscles weaken and the lower back starts taking over functions that don't belong to it. This leads to overload, stiffness, and discomfort. To fix this, we need to properly activate the region that supports the pelvis. That's where a powerful exercise comes in. Lying on your back, with knees bent, and lifting your hips until you form a straight line from shoulders to knees. Another essential movement is the side-lying leg raise. Lying on your side, you slowly lift the top leg, hold for a few seconds, and lower it with control. This exercise strengthens the hip abductors, which act like shock absorbers during your steps. When these muscles are strong, walking on uneven sidewalks or climbing ramps is no longer risky. People who train this area report not only greater stability, but also improvement in hip and knee pain. Now imagine putting it all together. Standing up from a chair without support, strengthening your glutes with the bridge, building endurance with the side plank, and gaining stability with the side-lying leg raise. This combination is like a complete recipe against falls. It's not just about strength, it's about teaching your body to balance in all directions. And there's still one essential detail: teaching your body to relax and recover. That's because the body doesn't get stronger during exercise. It gets stronger during recovery. There's a yoga pose called the adapted child's pose that's perfect for this. Simply kneel on a soft mat, sit back on your heels, and lean your torso forward, resting your arms on the floor. Take deep breaths and relax for 1 or 2 minutes. This pose gently stretches the back, relaxes the hips, and loosens the shoulders. For those who feel stiffness, insomnia, or stress, it's a true physical and mental reset. Including this relaxation moment at the end of your routine makes all the difference. It not only helps solidify your muscle gains, but also reduces built-up tension, even improving sleep quality. Imagine ending your day with a light body, a calm mind, and refreshed muscles. That's exactly what this practice offers. Now think with me. How many moments in your life have you missed out on for fear of falling? How many outdoor walks, family outings, or gatherings with friends could have been easier if your body had responded with strength? The truth is, you can get that freedom back. The path isn't complicated. It lies in simple movements, done with attention and consistency. Age doesn't define your limits. What defines them is how much you allow yourself to take care of your body today. So don't wait. Start now, at your own pace, respecting your limits. But keep moving forward, because each repetition is a step toward your independence. Each exercise is a way of telling yourself, I still can. I still have it in me. I still have the strength to live with confidence. A practical example of this is the impact that strengthening the glutes has on daily life. When this area is weak, the lower back is overloaded, the knees work harder than they should, and every step becomes less stable. But when you regularly activate those muscles, everything changes. Your posture improves, pain decreases, and even the way you walk transforms. That's why the glute bridge, which we've already practiced, should be seen as an essential, almost mandatory exercise for anyone who wants to age with health. Now, I want you to realize something else. Balance doesn't depend only on leg strength. It depends on the coordination between several muscles. If only the front of your thigh is strong but the side is weak, your step will be unstable. That's why exercises like the side plank and side leg raise are so important. They work directly on the stabilizer muscles, the ones that correct your body when it starts to tip over. It's like a built-in safety system that activates in unexpected situations. Many seniors report that after a few months of practice, They not only feel stronger, but also more confident walking in challenging environments like sidewalks with holes or sloped ramps. That's because the body starts to respond automatically. What once felt like a risk becomes just a small balance adjustment. That's the big difference between training brute strength and training functional strength, the kind that really applies to everyday life. Now, more than ever, I want to hear from you. Which technique or explanation presented here caught your attention the most? Do you feel motivated to start applying these movements today to relieve your lower back pain? In the comments, tell us if you've ever tried back exercises before, or if this is your first time exploring specific strategies to release tension in this area. Also, share which movement sparked the most curiosity. Was it the thumb pressure on the exact pain point that brought immediate relief? Was it the glute bridge, which activates support muscles and takes the pressure off your lower back? Or was it the wall exercise, which trains the hips to keep the pelvis stable and finally reduce flare-ups? The truth is, there's no magic formula. What really works is consistency. There's no use doing all the exercises at once and then quitting. The secret is to do a little, but regularly. 2 to 3 times a week is enough to generate results. And the most amazing part is that you'll start to feel the changes in just a few weeks. The body is grateful. When you stimulate it the right way, it responds quickly. And here's an important detail. These exercises don't need to be intense to bring results. What truly matters is consistency. Doing just a few repetitions every day or several times a week produces far better results than trying to overdo it all at once. The body of someone over 60 responds better to frequent moderate stimulus than to extreme effort. This shows that it doesn't matter where you're starting from. There's always room for improvement. The key is to respect the process and believe your body can recover. Every repetition is like a brick laid in the foundation of your autonomy. The more you practice, the stronger that structure becomes. So don't underestimate the power of the basics. Don't think you need expensive equipment, fancy gyms, or complicated workouts. What you really need is discipline, patience, and consistency. Because each small effort accumulated over time creates a massive impact on your health. Imagine yourself a few months from now, walking with confidence, climbing stairs without fear, standing up from your armchair with strength, and most importantly, living without that constant feeling of fragility. That's the future you can start building right now. All you need is to start, even if it's just with 1 exercise a day. And remember, it's never too late. The body always responds when you decide to take care of it. So make the commitment to yourself today. Start with a simple movement, practice with focus, and allow yourself to reap the benefits of that choice. Because at the end of the day, it's not just about muscles or balance, it's about quality of life, freedom, and confidence to enjoy each moment with more energy and fewer limitations. I read every comment and use your real stories to shape our next videos, always bringing more evidence, practical tips, and real solutions to help relieve lower back pain. Subscribe to the channel, turn on notifications, and invite your loved ones to join this growing community. Remember, it's not about ignoring pain or pushing your body beyond its limits. It's about understanding the cause, strengthening the right muscles, and reclaiming your quality of life. It's about moving without fear, relieving your lower back, and turning each day into an opportunity to live with more comfort and independence.